Hi, everyone. Welcome to CFMA's monthly webinar series. Today, CFMA is pleased to present What's Under the Hard Hat, Mental Health and Wellbeing in the Construction Industry, which is sponsored by Procore. My name is Sue Madden. I'm the Education Manager here at CFMA and glad you decided to join us. Before we get started, I want to cover a couple things quickly. Today's webinar provides 1.5 CPE credits in the field of specialized knowledge. And now I'd like to take a moment to introduce today's presenters. With us is Darcy Guardadero, who is the director of the Center for Workplace Mental Health, where she leads strategy in providing employers with high-impact tools to effectively support the mental health and well-being of employees and their families. Before joining the center, Darcy served in multiple senior-level positions with the National Alliance on Mental Illness. She has expertise in policy, designing high-impact programs, and making mental health information accessible. Very glad to have Darcy here with us. And someone else who's no stranger to CFMA, Cal Beyer, who is Vice President of Workforce Risk and Worker Wellbeing for CSDZ, a Holmes Murphy company located in Minneapolis. Prior to joining CSDZ, Cal was Director of Risk Management for a heavy highway contractor in the Pacific Northwest. Cal has been a longtime contributor at CFMA. He was a past national CFMA officer and executive committee member, recipient of the Danny Parish Outstanding Leadership Award in 2016, and the Chairman's Award in 2017. In addition, Cal has been recognized by the Engineering News Record as a top 25 newsmaker for the global construction industry for his work on suicide prevention. He serves with the National Action Alliance for Suicide Prevention since 2010 and is executive committee since 2016, and on the Lived Experience Advisory Committee of the Suicide Prevention Resource Center. He's also a frequent collaborator with the Center for Workplace Mental Health. Welcome, Cal and Darcy. I know there's a lot to cover in today's program, so I'm going to turn things over to Cal.
Sue, thank you very much. And I want to give a big shout out to my co-presenter, Darcy Guardadero, who's been a great friend. Darcy, nice to see you today.
Thanks, Cal. It's great to be here. And we just figured out we've been working together for about 2 years, and it's just been great to learn from you on all the great things happening in the construction area. So I'm really happy to be here. Thank you.
Well, you've become a favorite collaborator and really just brought so much energy and such a vision around workplace mental health. And so happy to have you finally get an opportunity to present to my real home association, CFMA. A big shout out to CFMA for all the support over the years in initiating the Mental Health and Suicide Prevention Initiative when I was working for Lakeside Industries, and couldn't be more proud to see the traction that the Construction Industry Alliance for Suicide Prevention has gained. So thank you, Stuart Binstock, CEO, and really thank you to all the leaders, volunteers at the chapter level as well. This topic has grown out of the partnership that Darcy and I have built. And we have learning objectives today that are going to really introduce some new topics. First, it's one we talk a lot about at CFMA, human capital risk management, making a case for workplace mental health. Many organizations will put the emphasis strictly on ROI, but for us, it's been the human cost and the human benefit. Number two, we're going to talk about the invisible crisis in construction, going to talk about the pre-pandemic challenges that our workforce felt or faced. And then Darcy's going to introduce some new data that really shows the magnitude of workplace mental health. We have that woven in throughout our presentation, but today she's also going to be sharing highlights from the upcoming Mental Health in Construction survey that the center co-sponsored with my employer, our parent company, but also with you at CFMA. And I'm going to share information on the hidden costs and the risks that are hidden around mental health in the workplace. What happens when we don't address these topics? But we're also going to focus in on presenteeism. And we're going to talk about the productivity impacts, the quality, risk, safety, and ultimately profitability impacts. And lastly, we're going to share information about comorbidities, kind of leading indicators that can escalate claim costs. And the same impact will be seen in workers' compensation costs. And then Darcy's going to conclude with a really cultural and leadership imperative around building a caring culture to drive worker well-being and reduce workforce risk. So Darcy, those are the learning objectives. I'm excited to learn from you as always. Take it away.
Thank you, Cal. I'm really excited to share the information. And again, I really want to thank CFMA for their leadership in bringing this topic, but also in helping to sponsor the survey. It's really great to have them involved. So I really want to level set us on the case for mental health. And one of the ways to do that is really to start with the fact that mental health conditions are common. So they are more common than cancer, diabetes, or heart disease. And what we know is going into the pandemic, about 1 in 5 adults in the US experiences a mental health condition, yet less than half receive the care that they need. So under 50% of people that live with these conditions get care. And as Cal said, that has a major impact on businesses. And what's really problematic, and we all need to kind of figure out how to address, is the average time from the onset of symptoms, mental health symptoms, to getting help is about a decade. It's about 10 years. So we know that is a problem because mental health conditions, just like any other physical health condition, the best results come when people are identified early and connected with care. So it's really important that we help to close that gap in that long stretch of time. And then we kind of have the overlay of what I call the trifecta. So we've had the COVID-19 pandemic, obviously historic, very disruptive to communities, schools, workplaces, everything imaginable, families, everything imaginable in life. But we've also had in our nation, and really across the globe in a sense, some racial and political tensions over the last year that have been very tough, and also an economic downturn, which we're seeing shift a bit, but there's still a lot of concern that a lot of small businesses have gone out of business, local community businesses we're used to seeing in our communities are closed down. So the economic downturn is worrisome. We also have seen sustained stress, collective grief and loss, not just for those we've lost to the virus, but also the loss of the time that we had with our loved ones and with friends, the local communities we've lost, business communities we've lost, and isolation and loneliness that have come with people just not being able to get out socially. And that is slowly changing, but it still has had a major impact over the last 18 months as we've kind of had to stay closer to home. Even though many of us went to work, there was still that feeling that it wasn't always safe. Again, just all of this really resulting in extreme disruption. So I did want to share some data. I know this is not the easiest table to read, so I want to kind of draw your attention to some of the national numbers around people experiencing anxiety or depression symptoms. So that 30% top number circled, that's the national number, and that's about a tripling of people experiencing symptoms in our country of anxiety or depression. And then when you look down the age bands, the highest age bands of greatest concern, or the highest numbers rather, in the age band of greatest concern is 18 to 29-year-olds. So the numbers go slightly down as you go up in age, but we've had, like I said, a tripling or quadrupling of people experiencing symptoms of these conditions. And they're not necessarily at a diagnostic standpoint, but what we know is that they're sort of at a tipping point. So it's really important that we think about the right kind of support to provide to people so that they can kind of tip onto the side of wellness and not onto the side of a diagnosis. I did want to touch on the high cost of mental health conditions because there's really solid research here, and this surprises a whole lot of people. But the annual economic impact of depression in lost productivity from the World Health Organization is $1 trillion. Now that's globally. But in the US, it's $210 billion, the annual cost of depression. And that breaks down to about half of that representing direct healthcare costs, the sort of pharmacy, the ER visits, the outpatient visits, but then about half of it represents productivity loss. So presenteeism, people going to work but not being fully engaged, and then absenteeism, people missing days as a result of experiencing depression. Again, it's about 2 to 3 times higher in treating chronic health conditions when there's a comorbid mental health condition. So if someone has, for example, cancer or diabetes, the cost of treating that underlying condition of diabetes or cancer is 2 to 3 times higher when they have a behavioral health disorder on board. So as financial folks, that's a big consideration when you're really looking at your overall healthcare costs as an organization. And then what we know is that for every dollar spent on scaled up mental health treatment, there's a $4 return on investment in improved health and productivity. Again, data from the World Health Organization. And I included a quote there from Willis Towers Watson, the benefits consulting firm. They do a 2020 global survey report they do a global report every year. And they've really focused in the last couple of years a lot more on mental health and well-being. So I wanted to show you this diagram because although this study is a little bit dated, this is really the seminal data that most people reference when it comes to really looking at overall costs. And this is the iceberg of full costs for poor health. What we know is about 30% of cost is associated with things like medical care and pharmacy costs. That's often what we look at to understand what are our healthcare costs when it comes to poor health. But in reality, just below the surface, about 70% of what is spent for health in this country really comes down to lost productivity costs. So absenteeism, presenteeism, and also costs associated with things like replacing workers when people leave the workplace, some of the retention and paying overtime costs and things like that. So really, it's important that we look at the full picture when it comes to understanding healthcare costs associated with business and mental health and well-being. So we did want to pose our first poll question. This is how we can learn from you too. We have 6 of these in total. The first one asks, please share how comfortable your organization is addressing mental health in the workplace. A, we're behind or haven't really started. B, we're taking baby steps and wobbling a bit. C, we're ready, capable, and willing to do more, just need direction. D, doing more each year, it's getting easier, we're seeing more buy-in from supervisors and employees. Or E, feeling confident that our employees feel supported and know how to tap available resources.
It's nice to see those results start to come in, Darcy.
Oh, yeah. Actually, I'm very impressed at the consistency around we're behind or have not really started is the highest, of course. But taking baby steps is good too. 23% is good to see. It shows there's a tremendous amount of opportunity when it comes to mental health and well-being in the workplace. And on that note, I'm going to turn it over to Cal.
Yeah, thank you very much, Darcy. And I think this is great. Many organizations are at that beginning point. And before the pandemic, we had issues in construction with our workforce, with mental health, substance misuse, suicide risk, and others. I think what's really important to recognize is what we're doing about it. So more than anything, the most powerful part of this story is the hope and the path that we're on. Construction is now being viewed as an industry that has a reproducible model for other high-risk or at-risk industries to follow. I've been using a couple of phrases. One is what's under the hard hat, and 2, shining light on mental health and well-being. I find that shining light, it really does evoke that sense of hope and the fact that we're doing something about this. For years, these were taboo topics. They were things that we didn't talk about in the workplace. Again, with the support from CFMA, we were able to tackle really tough issues like suicide prevention. And it was easier in those days to talk about that because it was a crisis of life and death. And then we could talk about mental health. It took the pandemic for us to really be able to talk about and to write about substance misuse. So when we think about what we're shining light on, it's stigma. Stigma are those barriers that prevent people from seeking care and accepting care. And I think we've come so far. I'm just excited to see the progress. So shining light on mental health. What we've seen, as Darcy's indicated, are many lingering effects from the pandemic. And that's causing a rise in some risk factors. So a couple of issues that Darcy talked about that are really relevant. That isolation and loneliness used to be middle-aged males like myself, and now it's the youth. Ages 19 to 30 are associated with the highest degrees of isolation and loneliness. And that's caused a lot of pressures in our families and at home. One quick statistic, I know how much our CFMA audience likes statistics, but very troubling. Before the pandemic, youth 10 to 24, suicide was the second leading cause of their death. And during the pandemic, we had 1 in 4 youth ages 16 to 24 express ideations about suicide compared to 1 in 9 adults. So this is one of those dramatic concerns that we want you to think about at home, not just in the workplace. One of the big issues that we see is a lot of concern about burnout. And we're seeing many reports, 25 to 40% of workers actively seeking a new career. I've heard many companies talk about these sudden retirements, people really kind of saying, I'm not returning to the workplace post-pandemic. And a lot of companies are experiencing big degrees of involuntary turnover, that attrition. I think this issue of presenteeism, I'm going to cover in more detail, but it really is when someone is at work but not fully engaged. Our HR directors have talked about engagement, but this is an opportunity for us to think about it. Safety directors are very concerned by rising numbers of serious injuries and fatalities, and also just the implications this has: productivity, quality, risk, and then profitability. So we're going to talk a little bit more about that. The areas that I have been focusing a lot of my time on over the last several years deal with fatigue, chronic pain, and substance misuse. Those are the opportunities for us to improve the quality of life for our workers. And the big issue that I think is very shocking to people is how the opioid and overdose crisis has reared its ugly head. We'll share some data here in just a moment. And then obviously CFMA, our ongoing concern about reducing suicide risk. Many of these factors, if left unresolved, can result in suicide. So moving this upstream, making this more of a prevention strategy, is why topics like this are so important. And for me, that's the reason I'm excited about workplace mental health. It allows us to move people on the path toward earlier intervention. So that's why we're here. A couple of these factors we've talked about, but pre-pandemic, one I'd like to highlight is the ongoing increase in positive drug tests throughout the economy, not just construction, but 16 consecutive years, there was an increase in positive drug tests. And many people would say, hey, it's just legal marijuana. But the potency of marijuana today is so much higher than it was in the past. And we have many safety-sensitive positions in construction. We have many industrial owners that have a zero-tolerance expectation. So it's hard for us to build that caring culture, not kick people to the curb when they have a positive drug test. We need to do more on the education side. And I've seen the same thing happen with heavy and binge drinking. Our industry has had the second highest rate of heavy or binge drinking. And that's been defined by the Substance Abuse Mental Health Services Administration, SAMHSA, as 5 to 7 drinks in a single setting of 2 to 3 hours, multiple times each month. It used to be that we swept that under the carpet, and now we're having companies take new approaches to educate employees about the risks and the consequences of excessive alcohol use. That's going to be one of the challenges that we can continue to do well on. Last year, early in the pandemic, I wrote a toolbox talk on the risk of relapse when the government shutdowns occurred to help people find virtual meeting rooms for recovery. And likewise, with the civil unrest, I had to write toolbox talks about domestic violence, intimate partner violence, but also caregiver response, PTSD for veterans, first responders who are active in the construction industry. We're experiencing signs of PTS. And these were all big issues. Last, I hate to be a bearer of bad news, but Workplace violence is on the rise, and in many industries, there have been manifestations. When you see this many firearms combined with big excessive alcohol, I just have concerns. This is a time to evaluate your active shooter protocols, work with safety, bring in law enforcement, really look at some of your security protocols. Those are some of the rising workforce risk factors that I've been concerned about. One group I've done a lot of work with during the pandemic has been the iron workers. I did a presentation with a gentleman named Sean Neely. He's a new friend. He's vice president in the New England region. Sean shared his journey over a 10-year period with addiction and how it impacted him and his family. He's really a brave hero. And Sean and I did a joint presentation. And Sean was asked, why are we talking about this? Because Cal, I want to help take down the wall one brick at a time. That wall consists of bricks with these labels, everything from loneliness and shame, fatigue, the opioid issue, pain, substance misuse, and ultimately suicide. This image has been really well received. It's been another powerful message. And now we have people calling out what brick they want to improve in their life. So we do want to share quickly on this issue of opioids. This has been something that's been a big issue over the past several decades. It's one that the National Association of Home Builders addressed. It's one that a couple of the labor unions and the North America Building Trades addressed with a task force. My concern is this is adversely impacting the construction industry. What this data table is going to show you is the rise during the pandemic in the number of overdose deaths, which are predicted when the final data is in to be 2 times the number of suicide deaths for 2020. So that is of concern. And I want to share with you just 2 quick data slides. This will show you the historical perspective, but about 70% of overdoses involved opioids. And the one on the right will show you approximately 73% of opioid deaths involve synthetic opioids, specifically one named fentanyl. There are different associations sharing information about opioids. The Keystone Contractors Association will be one. I'll be sharing additional information with CFMA. But these are topics to educate our workers on and the workforce. And I'm really pleased to see our industry tackling this issue with the same intensity that we did suicide. And that leads me to a quick slide. New data came out last year from the Centers for Disease Control, January 24th, 2020. For the first time, we had data not only for the industry, but by occupation. And the data was restated to be 45.3 suicide deaths per 100,000 workers, estimated at over 5,000 suicides each year. The important part is that's about 3.5 times the national average of about 13.93 per 100,000 in the population. But what's alarming with this data is how some trades are significantly higher yet. I don't have all the data listed here, but here are the top 9 trades, all of them at or above that level of 43.5. And so where I've been spending my time during the pandemic is with top trades in top 25, top 30 states, trying to introduce the topic of mental health and suicide prevention. So we talked about some of those invisible crises in construction. We'd like to ask you a poll question. Which of these lingering risk factors is of greatest concern for your company? And we have 6 choices, so please respond to this question. Which of these factors is of greatest concern? Mental health and well-being pressures. B, burnout leading to early retirement. C, presenteeism and distractions. D, fatigue, chronic pain, substance misuse. E, opioids and overdose risk. And then F, suicide risk. And Darcy, I'm not seeing the responses. So I'm going to just wait for a second. Here they come.
Yeah.
So please take a few moments and vote. I'm seeing the responses come in now. We'll record those in just a moment. But number one, risk thus far is burnout. B is presenteeism. And then the third, the fatigue and chronic pain. D and E, the opioid and suicide risk, were 2% each. That gives us really good perspective, like Darcy said. So thank you for sharing your perspectives on that poll. And what we'd like to do then is just move forward. Darcy shared a little bit of this information. It's always shocking when people hear, but the National Alliance on Mental Illness has a great website. It's Mental Health by the Numbers. And every year there's an update, and it's a great resource. It doesn't change a whole lot, but this was one of the shocking figures years ago when I was moving into this space. At 11 years from the onset of symptoms to diagnosis and proper treatment. I said, boy, if we're not doing a good job in the workplace, we're not doing a good job in society for that to be the case. And really, this is why we talk so much about care seeking, breaking down barriers and helping people find a path toward treatment and recovery. What's been interesting, Darcy shared, is more than 50% of individuals with a diagnosable mental health condition don't seek treatment. The most current number was almost 56%. So only 44% of people will seek help. I love Darcy's emphasis around depression. It's one of the topics that we hear a lot about. We also hear about anxiety and substance use disorders. But depression, it shocks people, can really be a leading cause of disability. And in the US, it is among persons of age 15 to 44. If you've ever known a person with disability, it can truly, or depression, I should say, a major depressive incident can really be a disabling event. And it's hard to get out of bed. It's hard to get clothed. It's hard to do the basic chores of daily living. And this is the type of sensitivity that we are trying to build to help people get help sooner so their condition doesn't progress and worsen. And in the global economy, depression will also be a leading cause of lost productivity. That's according to the World Health Organization, and that will be the factor in all developing economies. So I think it's important for us to just think about those human costs, and more importantly, the consequences. That human toll is what we're trying to help prevent. Now, this phrase, presenteeism, it's been around for quite a while. When we hear HR directors talk about engagement, I always wish there was more hard data just for construction. We have talked to universities, we've talked to professors, we've read studies that look at presenteeism. To date, this is understudied in blue-collar professions, but I'm hopeful some of the data sources we're starting to see are addressing this topic. Presenteeism is when someone comes to work but is not fully engaged, not really present. So we know the risks of absenteeism on a job site. We know the risks of productivity. We know the risks of affected morale. Presenteeism can have that same effect. It's where someone would be withdrawn, isolated, moves to be alone. And there are many reasons for that presenteeism. I've listed a few of them, but concern for someone else, a family member, a loved one, concern about their job, concern about their mental health. Could be an injury, it could be an impairment, could be signs of a hangover. There's many different factors that could lead to presenteeism. The important part is recognizing it. What's concerning is when people say things like, well, there's really nothing we can do about it. We don't let people work from heights without proper fall protection. We don't let them work around energized electrical equipment without proper arc flash gear. And there are many safety analogies. It is our responsibility to look after people that are displaying signs of presenteeism and engage them and ask if they're okay. Allow a safety timeout to be taken and for a crew to kind of come together and help manage that person. That presenteeism is a real risk, and it leads to a lot of impacts on job sites. The ones that I see are the loss of concentration and focus. Regardless of what task you have, construction is unforgiving, and it leads to a lot of serious injuries and fatalities when people are not fully engaged. Why this is so concerning is we spend a lot of time, a lot of money, and a lot of effort with the best safety technologies, safety innovations, safety improvements, and training. And when you ask employees what was going on, I'm not sure. I lost my focus. I lost my concentration. These are signs that could be pointing to presenteeism. The big issues are those serious injuries and fatalities. Pre-pandemic in 2019, our industry had 1,066 workplace fatalities, the highest level since 2007. That data will be out at the end of this year, and I think many of us are concerned. We've seen a lot of horrific incidents early in that pandemic that would lead to indications of presenteeism. The other clues that we hear about include rework and quality defects. We also hear about profit fade, productivity, unscheduled overtime, leading to schedule delays. There's many of these issues, and I want you to think about having an honest conversation with HR and safety about presenteeism and what that impact could be at your company. Some of the tools that we've been building as a team at CSDZ are to help us explain the impacts of worker risk and worker well-being. This is one example of a gauge that looks at low risk to high risk. And we just rated some of those stressors. And so I think it's important is, hey, everyone has stress. Everyone has reactions to stress. It's understanding those. But when stress becomes a distractor, it can have an impact on your well-being, physical and mental. And so each one of these has a different degree. And what you'll see is a listing of some of those factors, very individualized. Each person is going to have a different trigger, a different level. And the next slide is going to show some of those factors. You'll notice we said none are really in that low risk. We said the human condition is not without well-being risk. But what I'm trying to display on this slide that my colleagues and I put together is that the longer these stressors are not addressed, the worse impact it has on a worker's well-being. A tool I'm working on right now looks at the vicious cycle of chronic pain. And it looks at that interface between physical symptoms of pain and what happens with mobility, ultimately through well-being, isolation, and stress and anxiety. This is an example of a tool to communicate at the crew level, at the worker level, about mental health and well-being. And you'll see a lot of those factors. We've already seen some employee assistance programs kind of adopt this approach and having these conversations with their counselors to just have conversations. In this regard, it's kind of like which is the straw that could break the proverbial camel's back. We need to think about all of these risk factors having a cumulative effect. That's what we're trying to convey by looking at these heat maps or gauges. So Darcy, I want to thank you for the opportunity to present today. We're really excited about the data that we're seeing come in from the survey, some of the analysis that we're doing, and I know you're going to share additional information about that survey here in just a moment.
I am. Thank you, Cal. And it's, we like many of you, probably all of you as financial professionals, really appreciate the importance of data. And so we came together with the support of CFMA and the sponsorship of CFMA, and we developed a survey that we launched in March of this year, and we kept it open for just under a month. We had 1,175 respondents, and actually Cal's going to go through some of the demographics, drilling in a little bit. We are going to spotlight some of the key findings for you, and specifically around responses we received from CFOs and financial professionals, controllers, and but we do have a target date for releasing the comprehensive survey report that shows the results on all of the questions of August 3rd. We've also collected a series of construction case studies, really highlighting organizations that are doing innovative work when it comes to workplace mental health and well-being and suicide prevention. So we are going to be releasing that series of construction case studies by September 15th, which is nice because it's very timely given the survey report will be coming out. And we'll likely do a series of webinars too, and articles and other things just to really highlight the really impressive findings we had from the survey. So at this point, we're going to do one more poll. We're going to do another poll question 3. We're just really interested in who on this call completed the CFMA sponsored mental health and construction survey. So are you A, a yes, B, no, I do not remember seeing it, C, no, I saw it, but it got buried in my inbox, D, I don't respond to any surveys, so don't take it personally, and we won't, or E, I honestly don't remember. So we'll give you a moment on that.
I think, Darcy, you could tell by the way I wrote some of these responses on this poll, I felt comfortable with CFMA that we could tease a little bit there about not taking it personally.
Exactly.
We were really thrilled with the 1175 responses. We felt like that put it in the category of real legitimacy. It kind of exceeded even what our initial expectation was, almost double of what we were intending for. So I was very, very proud of CFMA for the support that we received.
Yeah, I would say we targeted 500, but we were really, really pleased with 1175. And I'm not sure, I'm not seeing the poll results. Oh, there we go. Okay, so this will be new to you in seeing the results, given that we don't have a huge number from this group, but we have some, which is terrific. So we really appreciate that. So at this point, I am going to turn it over to Cal, who's going to go through some of the demographics, and then I'm going to go through some of the other results. So Cal,
yes, thank you, Darcy. I appreciate that. So what's interesting, this map graphic really shows strong representation by size of organization. We listed these categories, and we really were curious what we would see. And so you'll see very, very strong, we think solid representation. It could be skewed a little more toward larger companies, and that could be a sign of people participating through an association. But when you look at this range from 21%, 1,000 or more, one thing that we suspect based on comments is that different companies might have had multiple people responding. But I think when I looked at the overall distribution, really satisfied that this is going to be applicable to companies at every segment and then every size. Sometimes I think we worry in construction that we're so skewed towards small companies, but I think here I'm really excited to see a broad representation. By segment, 78% fell in those 3 categories we frequently talk about. I'm so old school, I still use SIC codes, but within the NAICS code, we have those 3 main segments. And here we had about 29% specialty trade, about 26% we categorized as infrastructure, which we at CFMA talk about heavy highway. We've got the Talking Heavy group, and that's a big segment within CFMA. And then we also have a third category, which was about 23%. This would be that commercial property, vertical general contracting, or even that construction management. Those 3 segments really is very healthy. We had another category that looked at industrial. We did isolate and break out things like home building, just in case the survey, went viral. We wanted to segregate. I think with almost 80% in these 3, we can say this is really reflective overall of the construction industry in the US, but also the CFMA membership. The last area that I think we were thrilled with was the split by primary job function. Again, we partnered with CFMA. We expected strong participation among CFOs and finance and accounting. That was the number 1 category, 30%. And we were intentional about asking Stuart to co-sponsor this. CFOs are strategic leaders in your companies, and we knew that this would be a great place to gauge and also then direct our messages to. The second category was safety and risk management. Not surprising to me. You know, that's the discipline I come from, risk management, safety, health, and wellness. We had 22%. But I think that 16% representation by presidents of companies, CEOs, or owners, that's a really significant number. And when you combine the president, CEO, with the CFO and the CFMs or CFPs, as we call you at CFMA, 45%, that's strong leadership support. The last two areas, project supervision, 12.5%, and then human resources, 7.15. I think if we were to do this survey again, we would try to make additional efforts to increase those two areas, but overall, thrilled with the C-suite influence with those results. So Darcy, you get the fun job now of digging into the details. And
I did want to mention that for all of this analysis we're going to share with you, it's all from that first group that Cal just identified, the CFO and financial professionals that you all represent through CFMA. So we did want to share, again, we just handpicked a few things. There are plenty of other questions, and our survey report will really focus on comparing different respondent groups. But for purposes of this, we wanted to show you that CFO and controller and financial, accountant and financial professional group. So we asked about whether the organization recognizes the benefit of the EAP, and more than half of the respondents in that group either strongly agreed or agreed. So that was really great to see. As you can see, there's a pretty significant undecided group as well. That is a little bit surprising, although it may be that they just, and I'm looking for my actual numbers here. The undecided was 18%, and the disagreed and strongly disagreed was 15%. So, we did want to share with you that there is certainly a recognition of the benefit of the EAP, which is important because for many people, an EAP is their first entree into getting connected with mental health and substance use services and support. So it's a really key, and organizations pay for, in many cases, an external vendor to provide these services. So it is a service that's offered through the benefits program of organizations. When we asked about whether the organization promotes the services of the EAP, less than half of respondents agreed with that, either strongly agreed or agreed. So this surprised us a little bit. Promotion of the EAP is really important. And again, we wanted really to share that there's an opportunity. Again, there's a fairly good size undecided group, but there's a fairly good size disagree and strongly disagree with those that think the organization does enough to promote the EAP. So there's opportunity there because, again, this is key and critical when it comes to accessing services and supports. We also asked if the organization has seen a measurable impact from the use of the EAP. And this was really interesting to us because of a high percentage were either undecided or didn't know. And again, this is important that really, I think at the C level, and certainly with the financial professionals, really understanding whether or not the EAP has a measurable impact is important, since that is a benefit that's being covered by many organizations. And it's important to understand how effective are we in terms of ensuring that employees know that the EAP exists and that it's there for them, and understanding whether that's making a meaningful difference in employees who really need access to support, whether it's for a mental health condition or a substance use condition.
Darcy, I'm going to go off script real quickly. I think this was one of those powerful insights. I remember when you and I were talking about the scale that we were going to use, and we were really careful to not ask too many questions, and we were careful to keep our responses as succinct as possible. So we debated, right? Do we use don't know and undecided? And we agreed that they would be different things. This was really insightful when we saw this split between undecided and don't know. So we want to thank the audience too for being thoughtful in that response. It tells a different message if you don't know means you haven't seen the data. If you're undecided, you might not know. You're not maybe certain even if data exists. So that was an example, I think, of the thoughtful design that you put in place and where we reached out to some subject matter experts as well.
Yeah, and I will say that when we say, don't know or undecided, and when we talk about looking at the data, nationally, EAP use is at about 3 to 5%. So we know it's below what it should be. But on the other hand, more and more organizations are really looking at the aggregated data. Obviously, it's confidential, it's protected, but looking at the aggregated data to understand how well is our vendor doing when it comes to people connecting around mental health and substance use. Again, returning to the fact that we know less than half of people with mental health conditions are getting care. And it's that lag of, more than a decade for people to get connected with care. And we know all kinds of things can go wrong in the interim. On the next issue, this is a really good news, I think, issue in the sense that when it comes to addressing mental health at work, almost 100%, so almost 91% agreed that addressing mental health at work is a sound business practice. And clearly from what we showed you on the healthcare costs earlier, that is in fact true. We know that now from, depression being the number one cause of disability. We know the healthcare costs associated with depression and other conditions. And also almost 92, very close to 92%, believe it would be helpful to share resources to raise mental health awareness, reduce stigma, and encourage seeking help. Interestingly, a lot of you are just getting started, or your organizations are just getting started on this front. We heard that earlier in the poll. So this is a big opportunity to really get more engaged in addressing these key issues. And all of you, or many of you are certainly, or many of your organizations, I realize not a lot of you responded, but your organizations probably did. So this offers a really important opportunity to make a difference. Then, when asked if addressing mental health was an organizational priority, less than half agreed that addressing mental health at work is prioritized. And this is somewhat consistent with what we saw earlier. And about, more than half disagreed or don't know if mental health at work is a priority. So again, there's a lot of opportunity here. We gained a better understanding that there is sort of this opportunity for organizations to make this a bigger priority. And it's an important opportunity given the costs and what's sort of at stake when it comes to mental health and well-being and substance use too. So this was interesting, and we're going to talk more about creating a culture of caring. And this is very important right now because what we know is that people are moving a lot within different jobs. Some are leaving the workplace, some are moving to other organizations in very, very high rates. We know there are a lot of open positions in construction and other industries now as a result of people moving around. Those organizations that create a caring culture are much more likely to keep their high performers and the people they care most about because they're the ones that are making a difference when it comes to productivity and performance. So when we asked if organizations have created a culture of caring where employees can reach out for mental health care when it's needed, less than half, only 41% agreed. So that was really insightful in terms of the fact that there's a lot of opportunity here for organizations to better understand what is it that we need to do to really create that caring culture so we can really work well with retention, work well with our high performers, and really keep the people we want to keep who are doing the best job. Then, when asked if organizations believed employees needing help with mental health or substance use concerns are likely to seek care, again, this is a really key issue. What we saw is that only 21% of organizations that responded said yes. More than those that said yes, 31% said no, that people are not getting the help that they need or are not likely to seek care, rather. And a really high percent, almost half, said they didn't know. So again, an opportunity because it's really important for organizations to know whether people who are seeking care know how to get the care they need. The mental health and substance use system is very hard to navigate. So it's important that the benefits folks, the HR folks, and leadership really get a handle on what is it we need to do in working with our health plan and working with our EAP vendors and working across different levels of the organization to understand how do we make it easier for people to seek help when they need it. And then the final thing we wanted to share, again, this is just a snapshot. This is just key questions we thought would be of great interest to you, given your positions. We asked, why wouldn't employees in need of help with mental health or substance use conditions seek care if needed? This may not surprise some of you. I mean, shame and stigma are right up there at the top. And by the way, this was a select all that apply. That is a key issue. There's a lot of opportunity there. You can really work on that with raising awareness, with toolbox talks, with more visibility for mental health. Lots of concern around fear of judgment by peers. Not surprising in a professional area where the culture may be such, it may be male-dominated, it is male-dominated. There is concern about people perceiving it as character flaws when it comes to mental health issues. That is slowly changing, but there's a lot more opportunity. So this was a bit telling, but really, again, reinforcing the areas we know we need to really work on when it comes to eradicating some of these barriers to people seeking help when they need it. So we're gonna talk more about some of these areas in the remainder of our presentation. But before we get there and removing some of the barriers, we did want to do one more poll question with you, poll question 4. And we wanted to ask you, what do you think is most important when it comes to providing your employees and their families with better access to mental health and substance misuse care? Is it A, reducing stigma and normalizing mental health through workplace conversations and training? Is it B, promoting the company or union EAP? Is it C, increasing education for employees and dependents on how to access services offered by the company? D, expanding the type of mental health and behavioral health services that are offered? Or E, all of the above? So we'll take a moment to let you respond to that poll question.
Darcy, I remember the day we went through that data in terms of thinking about the people who wondered if people were getting care, and we saw such a high, I don't know.
Yeah.
This is an opportunity for us to really think about those barriers and how do we improve access to care. So your insight here is really helpful for us thinking about what tools, what resources, what strategies can we help develop for companies? Some of those case studies are going to be examples of some of these care seeking and care accepting strategies.
Yeah. I'm not seeing the poll results. Oh, they're there. Okay. Not surprisingly, all of the above, but also reducing stigma is high up there. I'm not surprised to see that. So that's really helpful to know. And then increasing education for employees and dependents as well. So great information. And at this point, I'm actually going to turn it over to Cal so he can talk a little bit about removing barriers and improving access to care.
Yeah, this is such an important topic. It's one that I'm actually doing an article in the series we do with Construction Executive. And we're talking about strategies to improve care. It's really interesting to find data from the Kaiser Family Foundation about percentage of males versus females that don't have a primary care physician. Not surprisingly, males have fewer, but there's also disparities by race and ethnicity. So I'll be sharing some of that information. If anyone wants to see that information, I can send you links to those articles. You can list that in the chat. Sue, Madden, and I will debrief at the end. That's been really interesting. Likewise, that NAMI, that National Alliance of Mental Illness, that Mental Health by the Numbers, they show statistics as well by gender and race, ethnicity, and other demographics on the disparity of people seeking help. What's been interesting to me for as long as I've been involved with the National Action Alliance for Suicide Prevention is we hear about these barriers to care, but I've had to go find this data myself. And now working with someone like Darcy, she points me in the right direction as well. We need to know more by industry. We need to know the statistics, but they don't exist. At least I haven't found them. So what I want people to think about is, like Darcy said, the importance of that EAP is so important. I can't even understate it. No matter how good we get with communication to our employees, no matter how good we get connecting with nonprofits and our health benefit carrier, the employee assistance program is a safe place for employees. And so that's one step. But what I've done is interviewed a number of contractors over the past 15, 18 months and really said, what are some of your best practices to remove barriers and increase or improve access to care? I didn't intend for us to spend a lot of time on these, but those 14 are examples that have been shared. We'll have an article coming out in the next 6 weeks with construction business owner. I partnered with the National Wellness Institute executive director, and I surveyed a number of companies with advanced wellness and well-being programs and asked them to categorize some of their best strategies. That will be another set of best practices. And why I'm doing that is to funnel people to Darcy. So on the Center for Workplace Mental Health, we can build more case studies. I know, Darcy, you're probably saying, stop. It's hard for us to keep up with this demand. But there are many examples in our industry of union and non-union companies that are doing great things to break down barriers. I want to just give some hope here. Engineering News Record has been a huge supporter, ENR magazine, of the Construction Industry Alliance for Suicide Prevention. They've provided free advertising to the CIASP, and that's preventconstructionsuicide.com. They're working on a cover story with this survey. It's going to come out in August. And I was able to help connect them to a number of union and non-union companies who had employees who were willing to share their stories and to be photographed and to really come out and be brave about breaking down stigma. 7 years ago, when I was launching that initiative, when I was working for the contractor, it was impossible, if not harder, to find examples of people willing to share their stories. So that's what happens when we're successful at tackling stigma, and we can break down those barriers, and then people can seek comprehensive care. That treatment can lead to recovery, and that recovery leads to redemption. And our industry is going to have so many more of these examples because of the interest folks like you are taking and learning how do we address mental health in the workplace. So hopefully that list of 14 will continue to expand it over time. If you have a success story that you'd like to share, reach out, put it in the chat box. We'll monitor, we'll reach out and communicate with you as well. The other thing that I want to highlight, I talked a little bit about that EAP. These are just 5 quick knowledge check questions. I developed a survey. One has 8 questions, one has 15 questions. Our mutual collaborator, Dr. Sally Spencer Thomas, she's got the workplace guidelines for suicide prevention on her website for that product. They have a 15-question EAP assessment. I think it's really timely for every organization to look at your core EAP. And there is a difference between the free embedded EAPs that are part of the disability insurance program and those that are standalone. In some ways, you'll see you get what you pay for. And many organizations have not successfully rolled out their EAP. It's not been uncommon for me to find organizations that have not put posters up or shared wallet cards or any type of information to their employees about the EAP. And then we wonder why utilization is so low. I've said this previously, I think on a CFMA podcast or presentation. Darcy quoted that number of 3 to 5%. When we were starting this initiative, David James down in Arizona, Michelle Walker were 2 of those early adopters, Patsy Dunn. And we were asking companies to share with us their EAP utilization. and it wasn't uncommon to come back at less than 1%. We've only seen one construction company that was over 11%, and they spent 2 years communicating and promoting and educating their workforce. So this is a challenge, and it's an opportunity, to use Darcy's word. But those 5 questions will help you better understand. I think what's really critical here, that last question matches up really well with the survey question, and very few organizations are seeing the impact from their EAP. So I've been working on an article, cited a lot of data, a lot of studies. It's for the Construction Users Roundtable. I initially wanted to call it Maximizing Human Impacts and Financial ROI of EAPs. But that article will be out shortly. CFMA and the CIASP will have access to it, and I think you'll get a real good idea on how important an EAP can be. So Darcy, I'm going to turn the page here now to this term called comorbidities. We know that word to mean a coexistence of mental health conditions and physical manifestations. And the ones I wanted to talk about are the ones that are frequently part of employee benefits. So if you're a union contractor, it'd be pretty easy to say, well, this isn't my concern, except it is. The worker is our responsibility. We're responsible for their safety and health. We're responsible for their workers' compensation. Plus, as union contractors, we also pay into the health and welfare benefit trust. If you're a non-union contractor, you might think, hey, I offer benefits, but not every employee seeks these benefits. We need to start looking at this issue very holistically, comprehensively. What I have found is many of the employee benefit providers look at 5 major categories or conditions that have a comorbidity that impact healing and recovery times. And those 5 areas have been cancer, cardiovascular, diabetes, or what's called metabolic syndrome, mental health, again, largely the depression, the anxiety, substance misuse, and then musculoskeletal. We put a red asterisk here because the mental health and the musculoskeletal will overlap between workers' compensation and the employee health benefits. So until the last couple of years, it was hard to find a lot of data in these areas. And so what I've been doing is doing a deeper dive, really trying to understand what are some of these factors that are driving issues. I've had the fortune of partnering with a colleague of mine. Her name is Leah Spoor. Leah is an employee benefits specialist. She focuses solely on population health. Those are the folks that work with benefit brokers and benefit carriers to design strategies around wellness to decrease the human impacts and reduce the financial costs of those comorbidities. So here's a little bit of data. We know that depression coexists with many mental health conditions. And again, it's not surprising when you understand the symptoms and the causes of depression. What impact this has is lost productivity, like Darcy said, but also increased cost spending on those claims. It can also lead, as we talked about, the workers' compensation. One study that our company has done, that's Holmes Murphy, the employee benefits specialist, shows when a patient has a mental health condition and at least one of those other 5 comorbid conditions, claim costs increase by 126%. We share data with our clients doing a dissection or a deep dive to really look at the impact. When you see 2, 3, or more comorbid conditions with a mental health condition, those costs skyrocket. But more importantly, that person is not performing at their peak. And sadly, if it's a family member or a dependent on the benefits plan, it has a big impact on the mental well-being and worry and stress of the worker. So a couple of these examples manifest, and Darcy, I was really happy you shared this study that summarized the Integrated Benefits Institute look at depression. Different categories, you can see what a big cost driver depression really is. And this is one topic that many people in the workplace have been afraid to tackle. I have a deeper appreciation for what we can do about some of these topics. And hopefully your questions will help us direct some of our ideas around this. But in these categories of medical cost, pharmacy cost, and even combine then medical and pharmacy, you'll see depression in that top 5 or 6 cost factors. But when they're combined, it's 4. But depression, we've already said, has the biggest impact on productivity. But when you add all the cumulative cost buckets, depression has the highest total cost among all of these other mental and physical health conditions and chronic illnesses. What's important here is to really look deeply at chronic health conditions. And your benefit broker should be able to provide you with insights and data that's going to allow you to design those population health programs that can improve overall health and decrease your benefit spend. A couple of examples here with respect to the comorbidity. The persons living with depression have increased chronic pain. And you'll see that increased impact on health spend. This particular study was $4,300 additional per worker. So in construction, this could be a pretty significant impact on your benefit spend. Likewise, this issue with diabetes, that metabolic syndrome, some is genetic, but some is lifestyle. And persons with a disability or disabling chronic condition can have less mobility, and that can impact the onset of chronic condition like diabetes. And the other area that we've seen comorbidity, Darcy, this is a study I've seen you cite as well. People with mental illness less likely to follow through with their preventive health screenings. And this one happened to be 24% less proactive or preventive health screenings for cancer. These have significant impacts overall on our workforce, and really just vital that we think about this topic and what can we do as an organization to really build sensitivity around the human impacts and break down some of those barriers. A year ago at the joint AGC CFMA conference, I did a high-level summary of this data. It's based on 21 million health claims. It's from an actuarial firm many of you know as Milliman, but they looked at the cost implications from behavioral health claims. It's a little bit of a busy chart, but I like this summary better than what I presented last year. My colleague Leah gave me permission to use it. But what was very interesting, they had 10% of the claimants were considered high cost, and they were driving 70% of the total claim spend. And then you break down the data further, 5.7% of the claimants were driving 43.5% of the total claim cost. So you'll see this enormous disparity in terms of cost impact. This isn't to be discriminatory. It's not to be inflammatory. It's really to build sensitivity that we're going to take these workers as they exist, both on the benefits and in workers' compensation. So what I know about CFMA is armed with information, you're going to think about safety and health and well-being and wellness differently. And that idea of population health is an area that we could further explore. I think there's huge opportunities for us in the construction industry. So the last area I want to highlight in this section is when Leah and I do presentations, I've been teaching her about some of these emerging comorbidities in construction. So we talk a lot about that presenteeism. We've recently written articles on fatigue and really looking at fatigue and sleep deprivation. Some of it people will think is structural, that there's things we can't do about it, but we can. Things like night work that we have from state transportation agencies, as an example. We can change the way we schedule our workers. There's a lot of these strategies that just take knowledge and information for us to redesign. But the other chronic comorbidities that are really important that we've been addressing include traumatic brain injury. We recruit a lot of high school and college athletes who've been exposed to concussive injuries. We've also recruit heavily from the military, transitioning veterans. Over 300,000 military veterans post-Iraq war have been exposed to what they call the invisible wounds of war, traumatic brain injury. We need to look at the new style Hardhat, the climbing style Hardhat. We need to do tool tethering to decrease the number of fallen objects on job sites to reduce the struck by injuries that occur. And then things like the post-traumatic stress. It's important for us to be prepared and to offer people strategies and solutions before they manifest as workplace issues. One other factor that we've been tracking is through the pandemic, we were seeing an increasing number of presumptions. That's when a state adopts a workers' comp rule that we're going to pay for a broader level of injury. And there have been issues with respect to PTS among first responders. That could have an impact to us in construction. Many of us have employees who in rural areas in particular are members of volunteer fire service. So just maintaining awareness that some of these rule changes could have an impact on our workers' compensation as well. I know this is a bigger and broader issue, but I wanted to plant the seeds because these will be some of the areas that we're going to continue exploring. So Darcy, we have our last poll question. Love to get some input from the audience. What is your reaction to this information about comorbidities and behavioral claim costs? The first response was A, surprised. This is the first time I've heard or seen this correlation. B, not surprised. It makes sense intuitively. C, I heard there was a correlation, but I've not seen hard data. D, understand the correlation and have seen data. And E, my company has already analyzed claim data and we're working on population health initiatives. This will be really insightful. And again, this will help us identify where do we need case studies? Where do we need to share with you some best practices? So your insights will be valuable. And I see the results starting to come in. Not surprised, this makes sense. 27% surprised, this is the first time. And then C was the third, heard there was a correlation but not seen data. And 2% have already been looking at their claim data. So again, very useful. Sue, we want to thank you for populating the results in the chat to each of the poll questions. And Darcy, you're going to bring this home, instituting leadership and cultural approaches to a caring culture in workplace mental health.
Yeah, I mean, I'm seeing there's so many great questions and I'm super impressed. I've been reading through them. And so I'm going to try to build a couple of them into what I'm about to share. So at the center, we work with organizations in all industries of all sizes. And we really got to thinking as this pandemic was going on and as more and more organizations pre-pandemic were focused on workplace mental health. And we came up with a framework that we call LEAD. And LEAD stands for leadership, effective communication, adapting to change, and doubling down on access. And there's such a great example in the Q&A of a leader who has called out what he's done as the CEO of his company, setting an example for his staff by seeking mental health care and communicating how effective and important it is to take this initiative. Nothing, and I'm reading that directly from his question, nothing could be more important. Leadership set the culture in their organization. The more leaders can show even what's traditionally maybe perceived as vulnerability, the better, because the more they can make mental health visible and a priority, and the more that they can really show that they have pursued help when they needed it as a sign of strength, that sets a culture within the organization that it's safe to do so. And that's really important. Normalizing it, making it visible, talking about how to make it visible in newsletters, on the intranet, in what gets sent out to employees, in morning meetings before people go off on their teams and work. Leadership matters a lot. Effective communication is really about just routinely talking about mental health and wellness, and then creating feedback listening loops. A lot of organizations are doing pulse surveys, simple surveys. They're creating connections with team leads, kind of having meetings where they're asking, or raising that I'm feeling stressed and, it's been a tough year. It's been a tough 18 months. And I'm really curious as to how others are feeling. Setting that example that, stress is a factor for me as a leader, and undoubtedly it is for you too, is very important. And one of the questions, and some of the questions have been around, how do we start? And this is really an opportune time because we've been through a historic pandemic. This is a great time to talk about stress, burnout, that we know incidents of people experiencing feelings of anxiety and feelings of depression are on the rise. So this is the time to raise these issues. And there was another question in the Q&A around what about legal? Our CEO and legal have said it's not a good idea to raise these issues. There's always this concern of kind of the woodwork effect. People will come out of the woodwork, and also risk of liability. As a lawyer and a former litigator, I would argue the absolute opposite is true, that the risk exists in not really promoting mental health and well-being from a safety and health and safety perspective. So recognizing that your productivity and performance are going to be negatively impacted if people aren't getting the help they need when they need it because they're afraid to. And we've worked with a lot of organizations that had the same level of resistance from legal, and they made small steps in just sharing a little bit of information here and a little bit of information there. And the receptivity to that was incredibly powerful. And so they built on it, and now they're doing much more in very visible mental health. And legal isn't saying a word because they're really seeing the positive results of that. And there is not the woodwork effect. People are not coming out asking for ADA accommodations or saying we want more benefits, or, they're saying thank you. We appreciate the fact that you're making mental health more visible because we all have mental health at the end of the day. So this idea of adapting to change is critically important right now because, and it's not always easy, obviously, in construction to have flexible schedules, but really thinking about what kind of flexibility can we lead with so that we can make sure we keep our good people, we can retain good employees, really talking at the leadership level around what can we offer in flexibility, and how do we make sure that our managers especially are trained on mental health. We have released a training called Notice, Talk, Act at Work. We just released it. It's an e-learning module that's 35 minutes for training managers. There's other trainings out there. Managers are on the front line when it comes to mental health and well-being of their teams. And many know those people that are struggling, they just don't know how to approach the issue. So really supporting them is very important. And then making sure you double down on access so you know. And by the way, have your HR and benefits people do a secret shopper attempt to reach your EAP vendor, to reach your health plan. See how easy it is for them. And if it's not easy, and by the way, there have been secret shoppers out there that have done this, and they have gone back to their vendors and said, these are some of the changes that we need to work with you in partnership on. It's not a gotcha moment. It's let's work on this together. So I did want to share just a couple remarks around this whole idea of a caring culture. John Brewer with the Conference Board shared this on LinkedIn. I've worked with John. He's a really amazing person. But if you don't care for your people, why should they care about your strategy? And when you think about that, or why should they even stay with your organization? When we know there's openings in organizations around the country, why should they stay with you? That caring culture really matters. So really thinking a lot about how do we create that? I did want to share, in light of the CEO number 20 question, which I thought was fantastic, I wanted to share another example. I know Cisco is certainly not a construction company, but the Cisco CEO sent an email to employees expressing the organization's concern for those struggling with mental health issues and sharing that no one needs to go it alone. He was so surprised that he got more than 100 email responses from people. I mean, this is a CEO saying, hey, folks, I just want you to know if you have any mental health issues, you're not alone. And he got such a positive response. It led to creating this broader commitment to mental health and well-being. So when people think about how do we start, just one message like that from a CEO or a leader can really start that chain of events that leads to good result. So I'm going to just share our last poll question, and then we'll go to Q&A. And I know we're getting close to time, and you have asked the best questions, by the way. But we did want to get from you a sense of what factor do you think is most important in creating a mentally healthy organizational culture? Is it leadership commitment to mental health? Is it policies and practices supporting mental health, like flexible schedule, leave, open dialogue, communication? Is it manager training? Is it working conditions, number 4? Or is it ease of access to services and supports for mental health and substance use conditions? So this is our last poll, and then we're going to go to questions, and we're really interested in your reaction to that. Kind of how do you create that mentally healthy culture? Looks like there's a really good spread there. Leadership. I really appreciate the recognition of the importance of that. I think it really goes to the point made by by question 20. And that's absolutely the experience that we've seen working with organizations around the country in different industries. So on that note, I'm going to turn it back over to Sue for Q&A. And just to say thank you, what an engaging conversation in the Q&A we've seen.
Okay, Darcy, thank you. There were a ton of questions. And like Cal had mentioned in the chat, I think Darcy and Cal will take the time to answer the questions, and we'll send that to everybody so that everyone has the information. There's a great question here from Tyler. What are some tangible steps that we can take right away as an organization, leaders, to help our employees?
Yeah, Darcy, I'll take first crack. I think one of the first tangible steps is to have a conversation among your company leaders that you're going to make this a leadership imperative. And then secondly, really understand what capabilities do you have? What opportunities do you have for resources? How are you sharing those resources? And really think about the communication, how you can approach this. And then training of supervisors and leaders will be very important as well. But at minimum, better promoting that EAP. I like what Darcy suggested about that secret shopper. That lets you know that you're promoting something that is in fact healthy. It's one of the first places that we've begun as well. So don't promote something if it's broken until you can get that fixed. But those would be among some of those tangible steps.
Yeah, I also wanted to mention, I know there was a question around what if someone's not willing to reach out or people just really don't seem to want to use the EAP. And what I would say to that is we've learned a lot in developing Notice, Talk, Act, the training that we developed. And that question of denial comes up a lot. And by the way, it came up a lot in the survey responses too. So the one thing I would say is if you as a leader or manager know, and by the way, most people, as I said earlier, know when someone is experiencing change. It's usually change in appearance, behavior, mood, the way they're just acting differently. The most important thing is that you ask them in a very caring, empathetic way, is that you say, gosh, you don't seem like yourself, Darcy. Here's the changes objectively, not mentioning mental health. Here are the changes I'm seeing. You're showing up late. You're not performing at the level we're used to seeing, and I'm concerned about you. So I want you to know we have an EAP available. Now, you may get the hand, but that's okay because you've shared information. The person may or may not use it. And then the key is to check back in because the check back in part is really important. And checking back in an empathetic, caring way matters. And the other thing that matters is trust. So if you have a manager who's had a bit of a contentious relationship with an employee, they may not be the best person to approach that other person they're concerned about. So maybe think about, maybe it's HR, maybe it's a benefits person, maybe it's someone else. Now, again, it's really important that confidentiality and health information is protected. This is not about asking people about a condition. People are entitled to keep their health information private, but the key is to show that you care, to let them know what exists and what's available, and then to leave it at that.
Okay, great. Here's another one. Do you see much in the way of employee hesitance to return to work after COVID due to fears of illness or lack of faith that employers will protect them?
Do you want me to take
Yes.
that? Yep.
Sorry, Darcy. Yes, I feel we hear this a lot. I think some of the national surveys are showing concerns about employees. We ask companies to communicate a reassurance. We're in this together, being compassionate, being empathetic, as Darcy indicated. The companies that appear to be handling this transition well have been ones that have communicated with a regular cadence throughout the pandemic. They've demonstrated some flexibility, they've offered alternatives, and they've understood that work can be done in a multiple of workplaces. And that hybrid model does appear to be something that a majority of workers are going to embrace and request. I think it's going to be hard to answer this one size fits all, but I think, yes, there's anxiety. I think there's some stress. I think there are some childcare issues that we hear about that are creating a burden in some pockets. And companies are going to probably have to be very flexible and creative to find solutions that work for the majority of workers.
Yeah, I just want to emphasize that normalizing that people are going to be anxious is really important. And setting expectations around the workplace is not going to look exactly, we're not going to be 2019. We have a new dynamic that we're developing in the workplace. So really think about, how do you incorporate employees so they feel like they're part of setting up that new dynamic? And so creating those feedback loops, thinking about, doing something fun as people are coming back, reassuring people. Communication matters a lot. Over communicate with people around what you're doing on health and safety. So things like that are really important. But let people know. I had my first meeting in DC. I live in the DC area. I couldn't figure out where my Metro Pass or my shoes were, or, have people know that that's to be expected and that it's going to be different for a little while. And we're all in this together, as Cal said.
Okay, there's one more question here. Are more mental health physicians looking towards a more holistic approach to treat patients instead of the more traditional Western medicine that promotes medication as treatment?
Yeah, I think that's such a great question. And we have been working at the foundation a lot with primary care because we so believe, yes, we represent psychiatrists and we recognize that there's a very important place for psychiatrists, but we also recognize that most people that get mental health care, especially for depression, get it in primary care. And primary care, your primary care doc has a holistic view of your health and well-being. So it is really important that we better equip them to address issues like depression, like anxiety, and that we really think about, and certainly think this is happening more and more, this kind of upstream thinking about, how do we focus on prevention? How do we focus on lifestyle? How do we keep people from tipping, as I said earlier, into the depression and anxiety and substance use category? How do we keep them on the wellness side? And that does involve lifestyle issues, sleep, diet, exercise, and even with treatment, depression, the gold standard for depression is therapy plus medication. And then once you get your symptoms under control, therapy is what often carries people through. So again, absolutely great question, really important. And primary care will be on the front lines of providing care with our growing population needing mental health care.
Darcy, thank you for joining us today. Thanks to CFMA for prioritizing this topic. Really appreciate all the great input, participation in the polls, and great questions, like Darcy said.
Thank you so much, CFMA. It was great to work with you on the survey. Cal, it is always a pleasure. And thank you to all of the participants. This was a phenomenal engaging between the chat and the questions. I was trying to keep my attention on both. It is fantastic. What a group. Thank you so much for letting me be a part of it.
I just wanted to thank everybody and absolutely thank Cal and Darcy for their presentation today, which was fabulous. I think everyone appreciated all the information that you shared. Thanks, everybody. Have a great rest of your day.